Right. Welcome back, everyone. Thank you for coming anew to join us or for coming back after lunch. I hope you all enjoyed the discussion at lunch and maybe got to see some of the exhibitions in the museum. For those of you who are new to us, I'm Susan Evans McClure. I'm the program director of our Smithsonian Food History Project here at the museum. And we are going to start our third roundtable of the day. So the panel will be about 45 minutes, and then we'll have about 15 minutes for questions from all of you. And if you'd like to ask a question, which we hope you do, you can either submit that question over the internet using the hashtag Smithsonian Food, or you can hand in your little cards you received on your way in. We'll have ushers collecting those right before the question session starts. And then Jessica Carbone, can give a wave, Jess, is managing our questions today, so she'll be compiling everything and asking the questions of the panel. And as you are telling all of your friends what a fabulous time you're having today on social media, please also use the hashtag Smithsonian Food to follow along and share your thoughts. Several of our speakers today will be signing their books right after the panel. There's a full list in your program of that. And now I am happy to turn things over to Susan Strasser, the Richards Professor Emerita of American History at the University of Delaware, to start the conversation with this esteemed panel about the politics of labeling. Susan.
Thank you, Susan. And it is indeed an esteemed panel and an exciting panel. We're going to do this a little differently than the previous two panels did. Oh, I can't hear myself now. Which is to say that each of us is going to introduce her or himself and in addition, give a little 2, 3, 4 minute intro to our takes on the issue. And I include myself. I am a historian of American consumer culture. And with respect to this topic, the book that I wrote that is most closely aligned is a book called Satisfaction Guaranteed, in which I talk about the development of the brand, the original label. Way back when food first started being packaged, we saw labels, and I got these from the Smithsonian's Warshaw collection, that would say things like corn, and that would be the label.
Cool.
And so I wanted to give some historical background to the development of the label. First, long before the 1906 Food and Drug Act, the development of the brand, the notion that a manufacturer would mark a package with their own name and the contents of the package, and that would identify who produced and sometimes, hopefully, where the food was produced. The first law, federal law, there were many state laws, decades worth of state and local work on food safety went into the campaigning for the 1906 federal food and drug law, which was more about the label than about the contents. It prohibited interstate commerce in mislabeled and adulterated foods, drinks, and drugs. It was followed over the next few years by a lot of legislative wrangling and legal wrangling, much of it over drugs and not food. With respect to food, there was a 1913 amendment that said that the weight measurement or numerical count of the food had to be plainly marked on the label. In 1924, the Supreme Court ruled for both food and drugs that there could not be misleading statements on labels, even if they were technically true. 1938 saw a new Food, Drug, and Cosmetic Act, for the first time cosmetics being included in the law. For food, it set safe tolerances for unavoidable poisons or poisonous substances. It authorized standards of, or the development of standards of identity, quality, and how much the container was filled, and it authorized certain factory inspections. That law held until 1966, when the Fair Packaging and Labeling Act ruled that all consumer products in interstate commerce be honestly and informatively labeled. And for food, it put the administration and the enforcement of that with the Food and Drug Administration, not the Federal Trade Commission, which was where other consumer products were left. In 1990, the Nutrition Labeling and Education Act called for nutritional labeling on all packaged foods and enabled the FDA to define certain health claims like low fat and light. And by 1993, the nutrition label that we're familiar with was pretty well established. I do want to call attention, in 2004, there was a Food Allergy Labeling Act for labeling of foods that account for most of the food allergies. I want to point to two recent laws that I think we'll get to in the conversation. In 2011, not specifically about labeling, but the Food Safety Modernization Act, which I know Susan Mayne wants to talk about, and the new law about genetically modified foods, which was passed this July, and as NPR put it, nobody is super happy about it, so I'm hoping we're going to hear more in our panel. I want to raise a few issues for the panel. First of all, a reminder that not all foods have labels, and so we're only talking about some foods. Secondly, we want to talk about the kinds of information on labels. Who's the producer and where was it produced? These are the old branding questions, and so one issue that I want to raise is how globalization, for example, affects those older questions. The methods by which foods are produced, chemicals, drugs, antibiotics. What's in the package? Is it good for you? Does it do for you what you think it will do for you? And then some questions beyond identification and claims, like environmental effects and effects on the food system as a whole. And finally, I hope that we'll be talking about politics, specifically consumer interests versus citizen interests. Is there a difference between those? And I'm eager to talk also about the influence of industry, of big companies particularly, and how the politics of these situations get worked out. We have with us today Susan Mayne, the director of the Center for Food Safety and Applied Nutrition at the Food and Drug Administration, Jean Halloran, who's the director of Food Policy Initiatives at Consumers Union, which is the policy arm of Consumer Reports, and Michael Moss, who is a Pulitzer Prize-winning journalist and the author of Salt, Sugar, Fat, How the Food Giants Hooked Us, published in 2013, and currently working on another book about food and addiction. So I've asked each of them to introduce themselves and how their work impacts these issues and talk about the issues.
Okay, I guess I'll start. Or you want to go which way?
Why don't we just go Susan, Jean, Michael?
Okay. All right, so I'll go next. My name is Susan Mayne, and as you heard, I direct the Center for Food Safety and Applied Nutrition at the U.S. Food and Drug Administration. A little bit about my background. I'm a scientist by training. My PhD is in nutritional sciences. I have a minor in toxicology. And I was an academician. I was a professor at Yale University in the School of Public Health for 27 years. And that's where I've spent the vast majority of my career, and my passion has been food, nutrition, and public health. And less than 2 years ago, I joined the Food and Drug Administration because I really wanted to see how we could implement the science that I and others had been generating for public health. And so, as I said, I'm a scientist by training. I'm new to the regulatory world. You heard Susan just walk through all the different acts. There are other ones that affect the work that we do. I'll mention, for example, the Affordable Care Act is another one. The Affordable Care Act is what gave us menu labeling. And so just to preface some of the remarks I'll be making here today is that, Congress passes these different acts, legislation. You just ran through a list of them. And FDA and other federal agencies implement those acts. And you've heard about some of them today. Nutrition Labeling and Education Act, for example, gave us the authority to put a nutrition facts label on these packaged foods. Hopefully all of you know we've recently updated that to reflect current science. And we can talk about some of the different authorities, some of the tools that FDA has. So we work based upon the acts. We work based upon the authorities that FDA has been given. We have authorities on labeling, and I know we'll talk about some of those authorities here today, and how can we use that to help improve public health. We also have authorities with regard to food ingredients. What's added to foods? What are some of the contaminants in foods? Some of the actions I'm sure many of you are familiar with in the last 2 years that address some of those authorities. One was with regard to trans fats, these artificially produced, partially hydrogenated oils. FDA determined that they are no longer generally recognized as safe, and therefore they need to be removed from foods to protect public health. So that's one I'm sure people are familiar with. The other big one that we announced in June of this year was actions on sodium, and our concern that the sodium content of the U.S. food supply is too high. And it's a tricky problem because it's in so many different foods, so many different commodities, and how do we do something about that? Labeling is one of the tools. We've had sodium content on packaged foods for a long time, but we still have a big problem in this country with excess sodium intake. So we've been working, we issued draft targets for industry for public comment to try to systematically across the food supply begin to ratchet down the amount of sodium in our food. So these are some of the authorities we use at the FDA, and as I said, my background is food, nutrition, public health, and I'm learning and work with a lot of experts in my team at the FDA on how we use those authorities to improve public health.
Jean?
Okay. Hi, I'm Jean Halloran. I'm from Consumers Union, which is an arm of Consumer Reports, which many of you probably think of mostly if you're thinking of buying a car or a refrigerator. But we also do food safety test projects. We've tested chicken, beef, ground turkey, and pork in recent years for their bacteria content. And we always look at the labeling on that food. And we're very engaged with labeling issues, as a matter of fact. We've been concerned since our inception about their truthfulness. Are they truthful and not misleading? And do they provide all the information that consumers actually want? So our topic today is the politics of food labeling. And I wanted to focus on one thing. We often hear in the media that food labels are for the purpose of safety, and they should only be for the purpose of safety. This is almost entirely untrue. If you just think about labels you've looked at recently, they have almost nothing to do with safety and everything to do with things consumers just want information on. But by way of example, I came down here this morning on a plane and was given a package with some breakfast cookies that were on the front says pumpkin raisin walnut oatmeal. But when you turn it over and actually read the label, it's got 1, 2, 3, 4, 5, 6 lines of ingredients, which I won't bore you with, except that the pumpkin is actually pumpkin flavor, and the walnuts don't seem to be anywhere to be found. And there's soy lecithin and vitamin E and brown sugar and coconut and many other things in here. Also on the back are nutrition facts, which I think are quite helpful. They could be construed to be a health issue. They certainly help you if you want to eat more or less calories or more or less fats, and know the vitamins. So that's very important. But in fact, this is all essentially information, except for the very last line, where it says contains coconut milk, soy, and walnuts, which is done for people who have severe food allergies and need to know if these things are present because they could be life-threatening. So we're now in an era, though, where consumers are interested in more than just the ingredients and the nutritional facts. And most of these things, they're interested in where their food comes from and how it's produced, whether the agriculture system is sustainable or not. And the notion that these things should appear on food labels has become a huge battlefield, just huge. We take country of origin labeling. We went through 3 battles in the Farm Bill in Congress to get it to be required. And then there were 3 more cases under the North American Free Trade Agreement saying that this was unfair, and it got abolished for beef and pork. And maybe other ones will follow too. Labeling of genetically engineered food, another huge battle. It was enacted in Vermont, it was required. There was a fight in Congress that got it abolished, and now there's a ongoing process at USDA to have a disclosure system which will be primarily through something called QR codes, which look a lot like a barcode, and you need a smartphone in order to read it. Organic labeling is another one like this, raised without antibiotics. So I hope we can discuss some of those new and more controversial types of labeling more in this session.
Great. I'm Michael Moss, and I'm so glad you brought the pumpkin treat. Can I look at it just a second? Thank you. Because actually, well, it's funny because like just yesterday I did another show for Dr. Oz, God help me, right? But it was on the spread of pumpkin through the grocery store, and it was. I was a little embarrassed because one of my last pieces at the New York Times was doing a little video on the whys and wherefores of pumpkin spice flavor and stuff, and I thought I had slain that behemoth, and instead it's just sprouted more and more heads. It's all over the place. But I'll have to study this more in a minute. So I'm actually new to writing about food. In 2008, I was running around in Iraq and other parts of the Middle East torturing the Pentagon for failing to equip American soldiers with body armor, and I got into some trouble and had to come back, which I only mentioned because I went from one war to a different kind of war. There had been an outbreak of salmonella in peanuts being manufactured at that infamous factory down in Georgia, and my editor at the time thought I should take a look, and when I did, it became a story about the trillion-dollar processed food industry losing control over its food chain and ingredients, because weeks and weeks were going by, and the largest companies who were using those peanuts as ingredients and things like this were still trying to figure out if, in fact, they were using those peanuts, because there were middle people companies involved, and they didn't have a clear idea of that, as recalls and people were getting sick all over. And then that reporting on food safety took me next to the meat industry, where we all thought Upton Sinclair had solved the problem, right, 100 years ago, but he was writing about rats and people falling into vats, not microbes. And I was incredibly lucky to come across this trove of documents that put me inside, or rather that let me tell the story for the first time of the making of a single hamburger that sickened a lot of people because of E. coli. And in that case, it was sort of a story about the meat industry intentionally losing control over its food chain in order to avoid costly recalls that would be traced back to the slaughterhouse and then to other retail situations. And I was continuing to write about that when one of my sources in the meat industry said to me, you know, Michael, as tragic as these episodes of contamination are, you should really look at some of the stuff that my industry intentionally puts into their products, over which they have absolute control. And that's how I got onto the salt, sugar, fat thing. Again, a mountain of documents put me inside the companies as they're formulating and marketing, and we could talk forever about the extraordinary science they use in perfecting the bliss point for sugar and the flavor burst for salt and the mouthfeel of fat. But early in the reporting, I realized too that the marketing is so powerful for these companies, as powerful as the salt, sugar, fat is in kind of the third leg of their equation. The first being make that food cheap, make it convenient so it stays on the shelf for years at a time, but make it irresistibly yummy. And one of the things that makes their marketing so powerful is in fact the label on products. They care not one iota about the stuff on the back of the package, the little tiny fine print that I'm having more trouble every day reading. Their whole world and the best and most valuable real estate in the grocery store is on the front of the package. Where as the decades go by, you can chart the industry's response to people's cares over food safety, over nutrition, over health, et cetera, because they will respond on the front of the package with words like natural, or in this case, pumpkin, as a way of distracting us from that ever-growing and ever-fine fine print on the back of the package, which tells us what's really going on inside the products. So I hope to talk a little bit more about the front label as well.
Wow. I have this whole list of questions, and I have to say, just listening so far has highlighted a number of particular points that I'm hoping that we can address besides my whole list of questions. First of all, can we talk about safety as a concept a bit? What we mean by safety, how safety gets defined, what we think consumers are looking for in terms of safety, what the government is meaning by safety, and whether that's changed.
So I can start, because
Sure.
we're responsible for that for a large part of the food supply, but not meat and poultry. The U.S. Department of Agriculture is responsible for the meat and poultry examples that Michael gave. And I'm glad you mentioned the peanut episode. I mean, sometimes in our history, we have things that occur that lead to changes. And this predated me. I didn't live through that within the federal government. But there are episodes that occur that lead to changes. And an accumulation of many different food contamination events over the years, the Jack in the Box episode, things like that, what led to some of the Food Safety Modernization Act. And the Food Safety Modernization Act, I lived in the world of food and nutrition and knew almost nothing about it until I came to the FDA. And I hope people will understand what this means. And this was signed into law by the President in January of 2011. And it basically is the biggest change to the federal food safety system that has been done in probably 100 years. And what it's moving from is a reactionary-based system where we wait until there's a contamination event and somebody gets sick and we trace it back and we do a recall. It's moved into a very different framework, which is all about preventive controls. And you mentioned the supply chain with regard to the peanut manufacturers. One of the provisions of the Food Safety and Modernization Act is that manufacturers need to know their supply chains. They need to account for their supply chains. The food supply is complex, but manufacturers need to know, and they need to know about the safety and what has been done with regard to their food supply chains. The system is very focused in on preventive controls. Where are there points in the pathway where food can get contaminated? And how are manufacturers controlling that contamination and verifying that they've controlled it? So it's an exciting time in the food safety world because we have new legislative authorities to really impact food safety. The other thing that's happened is technology has changed dramatically. And we heard about technology this morning with regard to tractors and things like that. But the technology that we are using is genomic technology. And that is things like we can now sequence the genome of a bacteria. And we can look at people who've become ill with foodborne illness, and we can isolate the bacteria and sequence it. And then we can check our database of now 90,000 different sequences to see, do we have a match here with regard to a particular food? And what we're finding is we can identify outbreaks now using genomic technologies that never would have been identified in the past. We can intervene and we can prevent people from getting sick. So food safety is in a really different world, and that's what I'm talking about with the microbial safety. The other things we care about are things like chemicals in our food supply and the chemical safety. We also concerned about the healthfulness of our food supply. So when we talk about food safety at FDA, we're thinking about all of those things: microbes, chemicals, contaminants, things like inorganic arsenic. All of those issues are things that we work on and that we care about in terms of the safety of our food supply.
Jean, what about the sort of expanding definition of safety that I heard in your remarks? Can you talk some about that?
Right. Well, having spent probably 3 years of my life educating, lobbying, writing about the problems lead from peanut butter and spinach and several other examples that finally led to Food Safety Modernization Act. I do have to say that it was a very good and important piece of legislation, and FDA has done an extremely conscientious job of carrying forward what's in that law, and hopefully, we'll start to see results in terms of less problems in the products FDA regulates, which are fruits and vegetables and processed food, and fish except for catfish, right? But not meat and poultry. On the other hand, we have some really, it's not, also, I have to say it's not perfect, but we're certainly improving there. With regard to USDA regulated products, we have this really peculiar system where some products are regulated by one agency, another by FDA, which is under HHS, and it's really not the best system. Most countries in the world have all their food safety regulation in one agency, but we're kind of stuck with this for historical reasons. And we have a situation where we do have these wonderful techniques of genomics and figuring out, like on CSI, right? What's the genetic fingerprint here? And yet, at USDA, they say that because of the way their law is written, they can't demand a recall unless somebody gets sick and they can find in the refrigerator of that person the meat that made, or chicken that made him or her sick, and that package have an establishment code and a date on it, and then they can order the recall of that product from that establishment on that date. And it doesn't matter if they've matched the code to many other batches from a particular facility. So there's a lot of legal catching up that we have to do. But in terms of safety and labeling, even though FDA has basic systems for requiring safety, in fact, most of the food we have on the market is assumed to be safe until proven otherwise. And we're going to have a lot more preventive controls in place, but that's still the case. And one of the things that we're worried about is with new technologies like nano ingredients, teeny tiny versions of conventional molecules, and genetically engineered food, where FDA has a voluntary consultation process on safety, and all the companies say, yes, they're coming forward for it, but it's not required. And pretty soon we're going to be having GMO imports, if we don't already have them, from other countries, and we don't know if they're going through this voluntary consultation process. So sometimes labeling can be helpful as a screen for consumers to say, well, it's okay, I'm willing to take a chance on this, but I'm not willing to take a chance on that. And that's hard to get recognized in our legal system. It's something consumers want, but it's hard to get laws passed so that consumers can do this.
Yeah, so I guess I did salt, sugar, fat because I sort of saw that as a bigger definition of safety. There's just this luscious meeting in 1999 when and I start the book with this because it's dramatic, the heads of the largest food companies get together for a very private, rare meeting. Usually they're at each other's throats for space in the grocery store, but they get together at the old Pillsbury headquarters in Minneapolis, brought there by none other than a cabal of insiders in their companies who are becoming increasingly alarmed about the safety of their products and their culpability. And up on the stage gets a senior official from Kraft who's leading this cabal, and he's talking about and showing slides showing the spread not of sort of salmonella or E. coli, but the spread of obesity and diabetes and gout. And he starts linking processed food to several types of cancers. And in that meeting, I won't bore you with the outcome, but pleads with the industry to collectively do something on behalf of consumers. But his alarm, again, was not over the narrower sort of pathogen definition of food, but the 300,000 people who die every year from having an over-dependency on highly processed foods. And I think that, from my perspective, that's what the industry has been struggling with increasingly ever since then, as more and more people sort of care about what they put in their mouths and their bodies from that perspective. Is this stuff okay? It's not going to kill me in the next day or two, but is this stuff really good for me? And how do I really find that out on the label?
I would hope that we could talk actually about an even broader definition of safety that would extend the question of whether it's safe or not safe for the consumer's body to questions of whether it's safe for people living near production facilities, whether it's safe for workers, whether it's safe for the food system as a whole, whether it's safe for the environment as a whole, the global environment as a whole.
Right.
So, I think, and the question is how much of this is getting manifest in labeling issues.
Right. I love that.
I'd like to comment on one of those that's, I think, becoming increasingly important is the issue of whether meat is raised with or without antibiotics. And we now have fortunately, quite a few labels that say a product is raised without antibiotics. And that's something that's, now why is that important? It's really not important for the safety of what you personally eat, because there are withdrawal times, and so by the time it gets to you, there isn't an antibiotic residue in the food. Where it's important, though, is the fact that we're using 80% of the antibiotics that are made in this country, we're feeding them to animals, and the bacteria in the world of the animals are being exposed to it, and they're developing resistance. So we're getting resistant salmonella, you know, the famous MRSA, MRSA, which is a plague in hospitals, shows up in pork production facilities. In fact, it showed up in every single product that we've tested in the last 5 years. There have been positive MRSA samples because we're using too many antibiotics. So what can consumers do? Consumers can choose products that are raised without antibiotics. But is that always a simple, easy thing? These labels are regulated by USDA. And of course, we have companies coming into USDA who don't exactly want to say the most clear thing to the consumer. So they're asking for labels like beef raised without antibiotics except for the last 150 days.
That's like grass-fed.
Right, right. So now, what's wrong with that? Okay, so all beef essentially spends the first year of their life without any antibiotics, wandering around in the prairies until they're sold to a feedlot, and it's in the last 150 days or so that they are getting antibiotics in these dense, confined growing conditions, which create all kinds of pollution problems and are just little fermentation beds for antibiotic resistance, for antibiotic-resistant bacteria. You know, or they say no antibiotics used for growth promotion. Well, that's maybe 15% of total antibiotic use, and FDA has put out guidance to say that nobody should use antibiotics for growth promotion, and all the companies are taking that off the label. But they're still using it for disease prevention, which is most of the use. So does the average consumer know the difference between growth promotion and disease prevention uses, and that FDA has outlawed one and not the other? Not always. So again, I've said all the, you know, that these are kind of battlegrounds for labeling, and that you know, constant vigilance is required both by the regulatory agencies and regulatory watchers like us, and by consumers themselves to know the true meaning of what they're seeing on packages.
Can I just comment on one
Please.
thing? Is, yeah, the labeling, consumers have preferences about labeling, and industry responds to those preferences. And there are certain things that FDA can mandate be put on a label, like a nutrition facts label, but there are other things that consumers are asking for on those labels that, for example, we may not have the regulatory authority to mandate those be put on the labels, but industry responds to consumer demand by putting new information on the labels. And so that's oftentimes what happens. You know, and most recently with the GMO labeling, where consumers were demanding it, and it finally went to Congress and ended up with legislation passed just 2016 on GMO labeling.
To what extent do you think that industry responds as opposed to leading or attempting to lead consumers to make demands? I mean, I'm sort of asking the where does consumer demand come from question, but.
I don't think industry leads very often. But you know, I mean, if you're in the business of selling something, it's your job to sell to what the consumer wants, and often, you know, I mean, generally we regard that as a good thing. You know, what's occasionally encouraging, though, is that if you do see sometimes a company who sees a trend coming and is willing to get out ahead of the curve. And we've seen that actually in the chicken industry, where Purdue about 10 years ago started looking into whether they could actually raise their chickens without antibiotics, and figured out that actually they could, and gradually ratcheted down their use so that now they're using almost no, they say no antibiotics in the birds that go out under their brand. So you do sometimes see a company who's will then see a competitive advantage on an issue like that. Likewise, McDonald's has just said that none of the chicken in their chains is raised with antibiotics. So that kind of thing is helpful, but it's rare and it doesn't come out of the blue.
And where do you think it comes from?
Well, it will come from a company who can see a trend coming and can see where they can have a competitive advantage in the long term.
And I think we're seeing that with healthfulness. I mean, one of the things we hear from industry all the time is that consumers today are demanding healthier foods. And what we're seeing is many companies, I mean, we say industry, but the industry is quite diverse. And there are companies that are making big commitments to make healthier products. Most recently last week, big announcement, PepsiCo, others trying to cut sugar, trying to cut sodium out of their product lines. When we put out draft targets to reduce sodium in the food supply, we go through a public comment process. We have some industries that publicly submitted into the regulatory docket that they support FDA in reducing sodium in the food supply, and they want to work with us. We have other companies saying it's too hard, we can't do it, and we oppose these actions. So I wouldn't say industry is one entity. There is a great diversity out there. There's also a lot of innovation, and we frequently engage with companies that are trying to do new things to be more proactive, again, highlighting those trends that are coming. Are there new ways they can produce foods to be even more healthful and address some of the issues that we've been talking about here today? And we engage with them about, from a regulatory point of view, how can we help provide that opportunity for innovation through the regulatory framework we have.
Healthfulness raises the same kinds of questions that safety does to me. Like, where do our definitions, our cultural and societal definitions, let alone our legal definitions of healthfulness, come from, and how do they change historically? What does this mean, healthy food?
Well, do
you want to comment on that?
It looks
Michael
like,
and I can
seems
respond.
like- seems like your question, Michael.
And I can respond too.
I'm not a nutritionist, and the sort of nutritionist probably, but it's pretty much what you don't find in 90% of the grocery store. I mean, that you could start with that sort of definition. And one of the fascinating things about the industry is that, it's incredibly risk averse. They don't like to invent anything these days because it's so costly and so dangerous to someone's job. That's why, most of the invention you see in the grocery store are new colored packages of potato chips as opposed to something truly reinvented from the ground up because it costs so much. But they've been incredibly skillful at leading our desires and yearnings when we walk into the grocery store. And one of the problems with sugar is not that they've kind of perfected the perfect amount of sugar in things like soda and ice cream and cookies. They've marched around the grocery store adding sugar to things that didn't used to be sweet before. So now bread has added sugar and an engineered bliss point for sweetness, and yogurts can still have as much sugar per serving almost as ice cream, and pasta sauces, as we know, can have the equivalent of a couple of Oreo cookies with the sweetness in a tiny half-cup serving. And what this has done is sort of created this expectation in us that everything should be sweet, and that's especially difficult for little kids who are hardwired for the sweet taste because their little brains see sugar as energy for their growing bodies. And it's a problem when you drag them over to that 10% of the store that sells the one thing that nutritionists seem to agree on we should all be eating twice as much of, which is, those things that have some of those other basic tastes that Aristotle wrote about, the sour and the bitter and what have you. And I'm talking, Brussels sprouts here. You're going to get that rebellion on your hands. And I think the same is true with salt, too. The lovely Monell Center at Philadelphia, which I always love to mention, has taken as much as half of its funding from the processed food industry, but has no qualms about biting the hand that feeds it. Did this elegant study recently where they looked at two groups of kids as to their salt liking. These are scientists who knew already that we're not born liking salt, or at least we're indifferent about it. We don't develop our taste or real liking for it until we're 6 months or so. But they followed two groups of kids, and one group of kids who was raised on foods that their parents made from whole foods in their house, and the other was raised on grocery store food. And guess which group was much more apt to be licking the salt shaker by the time they hit preschool? In that case, the industry has totally led us into not just responding, as they might be able to argue with sugar, but actually developing that taste for salt in processed foods, which is this miracle ingredient that does so many things for them. So now when they talk about cutting back on the huge amounts of salt in their products, I think it's yes, they're responding to consumer demand and realization that things are totally out of control. But to go back even further, you can see that in many cases they in fact were the beginnings of that chain.
Susan, I'm going to let you talk about healthiness in a second, but I wanted to encourage people in the audience to write your questions on your cards and put them in baskets, or you can tweet them, and the hashtag is Smithsonian Food.
The only thing I'll add on healthy is that actually has a regulatory definition on packaged food. And that's set in the regulations. And it basically says if a food has too much total fat, saturated fat, sodium, et cetera, it cannot carry the label of healthy on the products. That's an FDA regulation. But one of the things that has changed is that the science around total fat has changed somewhat, in that we now recognize that there's good fats and there's bad fats. And there can be products out there that actually could be pretty healthy for you that might not meet the current FDA regulatory definition. So what FDA said is we want to make sure that definition reflects current science. And we put an announcement out, it's called Request for Information, Request for Comments. We want to hear from people about what does that term mean? What should it mean? At the time that term was drafted into regulation, added sugar was not on a food label. Added sugar is not considered in the definition of healthy because it wasn't on a food label. So there's a lot of dialogue right now. And one comment is that the terms we see on labels are a result, things like healthy, are a result of a public process. And FDA wants to hear from people. We're asking for comments, and then we move forward with what we believe makes the most scientifically supportable sense, being informed by all those public comments. And it is a very robust comment process. The nutrition facts label, just to give you an example, had 300,000 public comments before we arrived at the new nutrition facts label that you will all be seeing once the compliance date comes into place. So we implement the laws through a very public process using science-based regulatory policy.
Comments about healthiness? Jean?
Here's my cookie again. Right? This one cookie has 250 calories, which you only figure, but the front of it is so appealing, It's like Dancing Bear Baking Company with the pumpkin raisin walnut oatmeal, right? And it's oatmeal followed by caramel, followed by cane sugar. The first couple of ingredients are all sugar, followed by heavy cream, butter, and salt. So this is a living example of what Michael's been talking about. And it's really hard for consumers. So this probably would, if they put healthy on the front, FDA would get upset.
They would depend on whether they meet the regulatory criteria.
But they don't have to
Right.
put healthy, they can just put added calcium. I know, I've
Right.
seen people go nuts for the words added calcium on the front of the package, and to them, that means health. That translates into the
Right.
word health, and that's how cunning these companies are in using the front of the label to kind of put people at ease and distract them from the fine print.
Right. So I think there's a lot of, when people claim environmental benefits but they don't actually have them, we call it greenwashing. And so there's a lot of health washing that goes on
Right.
in the,
Or the halo of health. And the
Perfect.
pumpkin's a
Right.
perfect example of
Right.
that, right? I mean, you don't even need real pumpkin, but even if you get real pumpkin, I mean, it's a tiny little smidgen, but it gives
Puts
that,
it-
it gives otherwise junky things like some credence. It's totally fascinating. We're gonna see
Right.
a lot more of that. We're gonna see a lot of vegetable powder in otherwise junky processed food now in the coming years.
I have dozens more questions, but I'm to turn to your questions. So, Jessica.
We got great questions from the audience. One major one, and so important to bring up right now, is really about science literacy when it comes to people understanding what these different labels mean. How do you account for the ways that knowledge of nutrition and nutrition science will change in the future based on the labels we have now and the recommendations that will come in the future from the FDA?
So nutrition literacy, I think, is a big issue. We're giving consumers information, but consumers have to know how to use that information. And teaching all of America how to get used to the new label, will be something that we're going to be doing in partnership with a lot of different groups. FDA does not plan to do this alone. We have big, major partnerships with all kinds of different groups, including the U.S. Department of Agriculture, which is responsible for the dietary guidelines piece of it. Teaching Americans about nutrition is a challenge. And I'd say not just nutrition literacy, but science literacy. It is a big challenge that we continue to work on. I am a scientist by training. I actually devote a lot of my time to go out and talk to people about the science of nutrition and what are our priorities. FDA has prioritized many of the issues that Michael just said, added sugars being on a new nutrition facts label. That was not an easy task to get that on the nutrition facts label, but that is what the science said, and that's what FDA moved forward on. Similarly, with regard to sodium, that also was not an easy thing to get those draft targets out. But we are committed to using science to prioritize the work that we do to improve the public health.
if I could comment on that, though. I think it's actually a remarkable percentage of the population that does look at the nutrition facts and understands when it says that this product contains 20% of the fat that you ought to be eating for a day. But it, in a way, it's kind of, it's putting a big burden on the average person. And there have been proposals, and think about just how people normally shop. Drive my friends crazy because I am reading every single label, and it takes me 3 or 4 hours to get through the supermarket. I don't go very often. But, a lot of people don't have time for that, even if they've gotten all the way through college and haven't forgotten how to do percentages. So one proposal that's come out of the public health community is for front of pack labeling that would quickly sum up, with something like a red light or a green light or some other kind of symbolism, if something is really good for you or not. And that's something that we hope, although it would be very difficult to do, and companies would, I am sure, really fight over how you defined what got a red light and green light with incredible vigor.
Sure.
But still, that's the kind of thing that consumers could actually, if we want to combat obesity and diabetes and all these diet-related diseases that we have, I think it's going to take something like that to help people make better choices.
Yeah, and maybe, I'm sorry, just quickly, maybe one of the other risks here too, though, is and this is a bit of a confession on my part, because as much as I've harped at the industry over salt, sugar, fat, I've spent time in the Nestle labs. They have 350 PhDs hard at work reformulating their products right now. And they showed me how they're taking fat globules and increasing the surface area so you get more mouthfeel, more bang mouthfeel for the buck and less actual fat. How they're taking the salt out of the inside of products and putting it on the surface so there's more flavor burst to the reward center of your brain. And of course, they're taking sugar and replacing it with non-calorie sweeteners. But again, when you talk to nutritionists, I mean, kind of the first thing on their mind is not necessarily even reducing the salt, sugar, fat, or anything else that's kind of on the back label of the product. The question is, okay, Nestle, great, but how are you going to take that Hot Pocket, which is their brand? They paid $2.6 billion for that brand in the early 2000s. How are you going to take that Hot Pocket and stuff that thing with broccoli and still make it affordable and luscious so that kids will eat it? That's how are you going to, and that's a real problem for the processed food industry. They can dial back on the bad boy ingredients as the rules come along and we focus on what, but boy, the question is sort of how do they get good stuff into their products is a real problem for that industry.
I'm so glad you asked, because we are getting questions about this from our audience. If the advice over and over again is that the good stuff is not coming from processed food, and people would rather go by Michael Pollan's mantra of eat real food, not too much, mostly plants, how then are food labels a stopgap for the fact that we aren't changing our habits? And are we too ingrained in eating processed food to really change our ways?
Yeah, kind of just who asked that question, by the way? Have I got a book for you? Yeah, I think so. I think that's a danger. You sort of nutritionism, or you hear that we're becoming kind of too scientifically, whether you believe food babe or science babe. We're becoming kind of too focused on those ingredients in the food and kind of missing that big picture. And it's a real question because the companies will argue, in fact, their ace in the hole is the year 2050 when there's 9 billion people on this planet. And I have a feeling that they think they're going to ride to the rescue with calories and that we won't care at that time where our calories are coming from. We will be so desperate for them. But in the meantime, you have more and more people caring about food, but it's really expensive and to eat well, unless you really work on it. And the Michael Pollan equation doesn't work for a lot of people at this point in time anyway. And so you do have that question, is there a role for ultra-processed food going into the future?
Soylent Green.
Sorry?
Soylent
And
Green.
well, that too. I used to make fun of the Soylent people. I have a little T-shirt somehow I acquired of Soylent, and I wear it kind of just for fun. But everybody's got a different attitude about food, and a food that you drink while you're sitting at your computer while you're coding, that kind of works for a lot of people at a certain point in their lives. So I'm kind of less. Yeah, I can sort of understand that, but yeah.
One thing I'll add, and it gets us more from my background as a nutrition person rather than from an FDA perspective, is giving consumers information is one piece of it, but enabling those types of healthy dietary practices is a whole other aspect of it. And we heard about that earlier, the problem of food deserts, and there has been some really significant progress made. We don't address these problems with one fix that's going to take care of the whole thing. We address it with lots of little bitty things. Yeah. So one of the things I will highlight is the Partnership for Healthier America has really tried very hard to address these issues of access. So for example, working with convenience stores, they are now making fresh produce available through convenience stores, through whole supply chains, to try to address this issue of access. Because there are many things that determine whether or not people are going to eat the types of diet that the dietary guidelines recommend, Michael Pollan recommends. Giving him information is one piece of that, but there's a lot more that has to occur. And there are actions taking place. We heard earlier in the Marion Nestle dialogue about communities and what's happening at the local level and how do we improve that, how do we provide access. There are many things that are taking place that will hopefully address that. The group I particularly worry about are the disadvantaged in this country. And what we've seen over the last several years is diet quality has improved in the United States. These measures that we collect as researchers, diet quality indexes, things like that, they have improved in this country overall, but we see great disparities. And some segments of our population have not improved. And so strategies to work with that, we're thinking about that with the Nutrition Facts Label update. Some segments of our population have the highest rates of diet-related chronic diseases. How can we teach them to use the Nutrition Facts Label to improve upon that? We have controlled studies showing when you teach people to use the Nutrition Facts Label, they do better on biomarkers of health status. So that is one of the challenges, that we confront, and we're trying to find solutions to that very difficult challenge.
One of the fun things in the grocery store now is in the produce aisle where produce growers are starting to steal ideas from the junk food industry in order to market their, who saw the avocado commercials during the Super Bowl in the last 2 years, right? Sort of this notion of turning marketing on its head and use that to tap those emotional buttons that the processed food industry knows so well. And a lot of it is kind of reclaiming ideas that the food industry stole from the produce aisle. Coca-Cola, right? Happiness? Who doesn't remember the Jolly Green Giant, right? Big happy guy trying to get kids to eat canned peas, mind you, but hey, whatever, And so now you have Driscoll's Berries with the Joy and Happiness campaign for berries, kind of reclaiming some of these marketing things. And it's, and it's debatable whether you really want to market vegetables like you market junk food. But I think it's fascinating that the produce industry is starting to think about this, and maybe even thinking about doing one of these checkoffs that the USDA has for beef and for dairy and what have you, where they self-tax the industry and collect tons and tons of money to market. The produce people are even thinking about doing that.
Jean, you had started to say.
The organic label, I think, has really been very beneficial in terms of creating an aura, if you will, which is well-deserved, but sort of drawing attention to real food which is grown in an environmentally sound way. But then every time that happens, when you get something like that, there is the danger that the label will be co-opted.
Right. Yeah.
And there are constant fights over the organic label in terms of maintaining its integrity. It's just every meeting of the National Organic Standards Board every year has new proposals to sort of downgrade it. Do the animals actually have to have access to the out of doors or not? Even though the law says so, and what's an access? And does that mean the chicken gets to go out, once a year, or, do they really actually wander around in the field all the time? So those are important issues, and labels can help, but they really have to have their meaning maintained in a rigorous way.
Right.
We're out of time, unfortunately, but thank you very much.
Well, thank you all.
Thank you.
Thank you to our panel for such a fascinating conversation. Clearly, there's more to talk about here, and we're going to take a break. Susan and Michael will be signing their books in the lobby, so you can all keep the conversation going. And then we'll be back here at 3 o'clock for our next panel, which was queued up perfectly here to talk about. And that will be our last panel of the day on the politics of health.